By 2015, the children of Ireland aged 5 years and under will have access to free GP care. So if I'm a parent and my child has a bad cough and it's a bit deeper than I thought it was the last time, but I'm not sure if I need to visit a GP, or she has a sore throat but I'm not sure if there's an infection there and needs medication, I no longer have to think at all about the cost of the GP visit. It's not even in the back of my mind. If my child has asthma and she's already been to the doctor 3 times because the winter is bad, and I have to go a 4th time, again, the issue of the cost of that, which is substantial at the moment, is no longer at the back of my mind. I look forward to that day. It has to be good for the child, and it has to be good for the parent as well. There's no question about that. In 2014, 16 primary care centres will open. It will include public health nurses, GPs, specialist nurses, occupational therapists, speech and language therapists, physiotherapists. The emphasis will be on prevention, on keeping people healthy, and on helping people with chronic illnesses manage their illnesses in the community. My niece was recently employed as an occupational therapist, one of the new occupational therapists employed with the HSE recently. And the model from which they operate now is so impressive. She's in schools every week. So she's no longer depending on a child to come in as a patient to a clinic or a hospital. So children with conditions and disabilities are not being as medicalised as they used to be. She goes into the schools. She works not just with the child, but with the parent and with the teachers to empower them to provide a better service for that child. So that child experiences a better wraparound service from all the adults in his or her life. So free GP care combined with the rollout of primary care centres will lead to early diagnosis. Why is early diagnosis better? It's better for the patient because you get treated before you get more ill. You get treated more locally, so you don't have to travel as far. It's better for the hospital system because you have less admissions into hospital. It's better for the taxpayer because less people need the higher cost treatment in hospitals, and they're treated more locally, so transport costs are cut down. I spoke to a few GPs yesterday. A couple of them, and by the way, this universal free GP care is welcomed by the Association of General Practitioners. They mentioned that all patients will have access to GP irrespective of means. They said parents will no longer sit and wonder or worry, does the child need a visit to the GP? They also said 2 other things that I hadn't thought of. One is, if you take the financial transaction out of the doctor-patient relationship, that may improve that relationship just a tiny bit, because it then becomes a purely clinical, purely medical relationship, which will improve things. It also improves our data on the health of our citizens. There will be more data available. So we affirm the Minister in his action to provide free GP care for 5 years, children 5 years and under. We urge him to continue his efforts to ensure that free GP care is also for long-term ill patients, and that's delivered. And I look forward to the day where we have universal health care, free access to GP.
Thank you for that. Councillor Owen Holmes now from the Laytown, Bettystown branch, supporting motion 53.
Here, look, delegates. The last budget